Hi, hello everybody. This is Amr Hasaballah from Egypt, an Egyptian endocrinologist, and here is a new topic. This calls ankylosing spondylitis. Ankylosing means fusion, spondylitis of the spine. Ankylosing spondylitis is an inflammation, which is an autoimmune inflammation of the spine and the sacroiliac joints. It's an autoimmune inflammation of the spine and sacroiliac joints, and it leads to stiffness. And here is the word ankylosis. Ankylosis means stiffness. It's one of the seronegative. And what's the meaning of seronegative? Seronegative is that there is negative rheumatoid factor, negative anti-CCP, negative anti-nuclear antibody, negative ANCA. And so it's a seronegative disease associated with gene called HLA-P27 gene. HLA-P27 gene. HLA human leukocytic antigen P27 gene. And the group of seronegatives are the ankylosing spondylitis, reactive arthritis, psoriatic arthritis, and finally psoriatic arthritis, reactive and ankylosing and finally enteropathic arthritis. Seronegative arthritis. The seronegative spondyloarthritis involves ankylosing spondylitis, reactive arthritis, psoriatic arthritis, and enteropathic arthritis. And so that's an autoimmune disease affecting mainly the spine and sacroiliac joints, leading to inflammation and stiffness, especially in the morning and especially with rest, associated with a gene called HLA-P27. Sacroiliac joints and the lumbar spine, there is pain and stiffness. This increases at night, increases with rest, increases in the early morning, and improves gradually with movement. And this is a reverse of disc pain. Fusion of the joints, and so in the X-rays rays, it's called the pampo spine. Pampo. It's like a pampo spine X-ray. As HLA-P27 gene is positive in 90%, and that's very nice. That's very good. We can use it for diagnosis. It affects mainly young adults, and that's the second thing, which is reverse to that of disc, which usually affects middle-aged or older patients. Young adult male, 20 to 30 years, and more than 3 months duration of low back pain and buttock pain, increasing at rest, increasing at night, increasing the early morning, and morning stiffness more than 30 minutes in the early morning. This is ankylosing spondylitis. Concentrate with me. Here is a story of a male patient, 25 years old, which is presenting to us to our clinic by low back pain and buttock pain, which increases at night. Agonizing, the patient is crying, "I cannot sleep, pain in my spine." And early morning and improves all over the day. So I need the day and I don't need the night. The associations of such autoimmune disease is with Achilles pain, Achilles tendon pain, enthesitis, dactylitis, which is inflammation of the fingers, uveitis, anterior uveitis, inflammation of the eye, and heart block in cardiology, in the heart. Let's complete. Associations also is interstitial lung disease and inflammatory bowel disease. Here is a bowel. Here is the colon history of the colon, like this, inflammatory bowel disease. And so in the GIT there is inflammatory bowel disease, in the respiratory tract there is interstitial lung disease, in the cardiology system there is a heart block, in the eye there is a uveitis, and in other articulars there is ankylitis and enthesitis. Here is a test called the Schuper test, and this test the spine of the lumbar 5 vertebra we mark on the back of the patient. Here is a mark, and take 10 centimeter above it, 5 centimeter below it. The whole distance is 15 centimeter. And ask the patient to bend to touch his toes. This distance, which is 15 centimeter, must increase more than 20 centimeter, which means that it must be increased more than 5 centimeter with this bending. If this increases the distance not less than 20 centimeter, there is limitation of the spine. There is ankylosing, there is stiffness in the spine. There is elevation of the inflammatory mediators, C-reactive protein and ESR, HLA-B27 gene will be positive. MRI of the sacroiliac joints, there is sacroiliitis and lumbar spines. There is inflammation of the intervertebral discs. X-rays. There is bamboo spine. Was the treatment options for ankylosing spondylitis? First, we give low dose steroids. Non-steroids, we can give two non-steroids. If this is in if there is no improvement on these medication, steroids like prednisolone 1 milligram per kg per day, non-steroids like ketoprofen, ibuprofen, or diclofenac. If there is no improvement, we can give the DMARS. The DMARS. The DMARS, either the synthetic DMARS, disease modifying anti-rheumatic drugs, which include what are the DMARS? Methotrexate, hydroxychloroquine, leflunomide. These are the DMARS. If there is no improvement on the DMARS, we can give the biologic DMARS, or the biologic anti-tumor necrosis factor alpha, like the infliximab or Remicade, the interleukin inhibitors, and finally the physiotherapy. I hope this video will help you to understand the ankylosing spondylitis. To summarize again, ankylosing spondylitis is an autoimmune inflammatory disease that affects mainly the spine and sacroiliac joints, associated with HLA-B27 gene positive, and one is the seronegative spondyloarthropathy. Seronegative means there is negative rheumatoid factor, anti-CCP, anti-nuclear antibody, anti-neutrophil cytoplasmic antibody, and it usually affects young male, and it's of more than 3 months duration. There is associated low back pain and buttock pain, increasing at rest, increasing at night, increasing in the early morning, with morning stiffness lasting more than 30 minutes. Systemic associations include dactylitis, uveitis, heart block, interstitial lung disease, inflammatory bowel disease. There is positive Schuper test, which is indicative of stiffness of the spine. X-ray shows bamboo spine. MRI, there is sacroiliitis. There is HLA positive B27. Treatment options are steroids like prednisolone 1 milligram per kg per day, non-steroids like ketoprofen, ibuprofen. We can use two non-steroids. If there is no improvement, we can give methotrexate. If there is no improvement, we can give infliximab. Thanks for good listening, and I hope this ankylosing is made so easy. You should follow us in our new channel, Amir Hasabala, an Egyptian endocrinologist. Thank you for good listening.